Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
Hi there. Welcome to the 86th episode of A Couple Takes on MS. Hi, this is Dan Digman.
And hi, it's me, Jennifer Digman.
Welcome to our show where I have relapsing remitting MS, and I've been living with it for a little over 20 years, and my lovely wife of 14 years, Jennifer.
I've been living with secondary progressive MS, well, MS in general, for, it's almost 23 years? 22 years, thanks for the correction, babe. And my relapsing remitting MS went away about 5 years after my diagnosis.
And so what we want to talk about here with A Couple Takes on MS, just looking at it from two different perspectives of a man with multiple sclerosis,
A woman with multiple sclerosis.
and one of us with relapsing remitting, and another with
Secondary progressive.
and just giving different perspectives on that. And looking at today, we're talking about breaking in a new neurologist. And I don't know how many out there have dealt with having a new neurologist. And we'll just look into the ins and outs and the whys and whys and how this happens. And I think really because something big is happening for me.
And vice versa, something big is happening to me as your loving spouse and your caregiver. So I think this is big for us both, but certainly it's all about you, babe. So it's big.
But it's about us, and it's about everyone out there in listener land. I mean, just like what that's like when you get a new neurologist, when you make that jump, when you shift and change. What are tips? What are insights? How do you deal with the feelings and what it is you're looking at? And so I guess we can look at it from this perspective. Just listen to this message. We got this phone call today, and I'm not saying I was nervous, but it made things real for me with what I'm dealing with.
This is Michigan Medicine calling to remind Daniel of your appointment on Monday, September 9th at 8:30 a.m. at Topman Center, floor 1, reception C.
So what's happening? I was diagnosed with MS on Valentine's Day of 2000, and so this now being September of 2019. My whole time living with multiple sclerosis, I had a neurologist. I had Dr. Call from the outset, from the beginning, and I really like Dr. Call. What happens then as we get older, so do our doctors, and Dr. Call retired. And so I had to find a new neurologist, and luckily I was able to jump on Jennifer's coattails and get in with her neurologist, Dr. Braley. But the difference there, I mean, among many differences, Dr. Call was over in Midland. We're going down to Ann Arbor, which is about a 2.5-hour drive. And so, I mean, that's just, I mean, this is just, it's a new experience for me because I've never had to deal with another neurologist with my multiple sclerosis.
I imagine that this is, if you can say it's bringing back memories of when you were newly diagnosed. Like, you said that you were a little nervous when you heard the message. It made it real that you were getting a new neurologist. But it's got to remind you a little bit about your diagnosis and bring you back to 19 years ago when you were filling out all the paperwork and you were meeting Dr. Call for the first time. Like, oh my goodness, who is this man? What is this disease? What am I facing? And certainly you have 19 years of knowledge now, but it's still a little nerve-wracking, isn't it?
Well, it is, and I have here a big thick stack of paperwork that I've probably got about like 4 months ago from Ann Arbor to fill out to have ready for my appointment. You're just kind of like, oh, that'll happen when it gets closer. It's like, dude, it's like it's here, it's in my face, and so I mean, again, it's not being dramatic about it, but it's just, I mean, these are just real things. I mean, you think that you get through everything, months ago. So it took forever to get everything switched over to get in to see the neurologist, get accepted by the University of Michigan Hospital, U of M Medical System in Ann Arbor. But then once you get the new MRI, and thankfully after 2 years, MRI showed no active progression, no active lesions, and so this is encouraging. But now it's here. I mean, and all the paperwork, and it's just like you start thinking, I'm going to have to. It's just a question: do we as patients? I don't want to say it's like we're training a new doctor, but it's like you have to basically revisit everything.
And would you say it's kind of like an interview? Like, because as Dan mentioned, Dr. Braley has been my neurologist for, goodness, probably 8 years, I would say. And so Dan, being my caregiver, goes with me to all of my appointments. And Dr. Braley is fantastic as my doctor. She's always concerned about Dan's well-being as well, with him being my spouse. But when we go to the doctor on Monday, it's not going to be about me. It's
not
all
the Jennifer
about
show.
It's all about you, babe. And I mean, I guess, like, wow, that's going to be different.
I think what it is for me is I'm able to put MS like on the back burner. I'm able to, like you and I in our relationships, and we've talked about this before, where we're together, we're out in public, because you are in a wheelchair, and we've said this, that it's just like people always assume, okay, well, it's an MS function, you're in a wheelchair, and I'm your caregiver, and then just the surprise that people have when they find out that I also have multiple sclerosis. And so I take pride in the fact that I have an invisible illness, or that, not pride, I guess, but just like I feel I like being able to hide it and not be, at the forefront. So it's like I don't have to necessarily talk about it. And like even when I went and saw Dr. Call and do things, and I have my MRIs, that was almost like a private thing between me and DK, me and Dr. Call,
Yes.
and that was our deal, and that was what we had. And it's almost like, and when I would go down to Dr. Braley with you, I again was like invisible illness boy. I mean, and that's where Dr. Braley was great, was she would always talk to me as a caregiver and as somebody with MS. But I never had to let her in totally. I mean, she knew everything on the surface. I mean, if I want to say high level, and we didn't like do a deep dive into if we want to go all corporate speak on that.
Yes, I like that. Those buzzwords, that was nice.
But I never had to let her in on this. And so then this makes me nervous, because in all of the time we were together, never were you never met Dr. Call. You were never at an appointment with me. So I was that was my thing, and I was doing my thing.
As Dan mentioned, he would go to Dr. Call in Midland, which is about 30 minutes away from our house in Mount Pleasant. And this now is a 2.5-hour drive to Ann Arbor. And when you have your appointment with Dr. Braley, I'm going to be there. And I don't want to say that you keep your MS secret from me, because that's the furthest thing from the truth. but you are private, and she's going to ask you about some of the symptoms and the side effects and the things maybe you need to talk about, but I don't know, will you feel uncomfortable sharing everything, or will it be different? I mean, you're right, because for 19 years I've never been in an appointment, and now you're going to have to answer the question. And I imagined maybe the fact that you're a caregiver, doctor will say that's a little stress for you, or is that too much for you? And maybe these are going to be some uncomfortable questions or conversations. And then, of course, the normal question will be about your disease modifying treatment and the way that you're walking and how you're doing. I mean, I don't want to talk too much, but I can imagine why you're nervous.
Well, and it's knowing this is where everything's been controlled, everything's been managed, everything's been predictable, and I would go to Dr. Call in my meetings. I'd have a meeting, or doctor's appointment, yearly checkup, and I would leave and I would tell you exactly what he was going to ask, exactly what he was going to say. With any questions I'd have for him, I kind of knew where he was, where things were going to be. I guess, yeah, there's some fear that I don't know if doctor, like with my treatment, with my disease modifying therapy, is Dr. Braley going to do status quo? And I think she will. I think that she, even in our conversation with her at your last meeting, as we were prepping for this this appointment, and I was saying how the challenging thing was because with new insurance, and I didn't have coverage directly or immediately for my beta seron, and how just what I was going to have to do. And she says, well, that's silly. If it's something that's been working for you, why would you change? And so I think, and there's that comfortability that Dr. Braley, that we're on the same page. But then I guess the question that I have, when people, I mean, because you changed to neurologist, several years ago, to even get into the U of M system, to have Dr. Michael, Dr. Boster, to Dr. Braley. But then it's a question, you had your original neurologist for many a years, like who originally diagnosed you.
He was there at the beginning of my diagnosis and the early years of my treatment. And at that 5-year mark after my diagnosis, I would say that's when my symptoms started to worsen and the medication wasn't working. And I liked my neurologist, and this is a point I was going to ask you. He was a general neurologist. He saw Parkinson's patients. He saw patients who had strokes. He saw people with MS. He saw epilepsy. Much like your doctor in Midland was a general neurologist. The University of Michigan, where we see Dr. Braley, that's an MS clinic. They specifically see MS patients. And that, when my previous neurologist wasn't exactly comfortable with a treatment that I was interested in taking, he said, with my blessing, I'm going to send you down to Ann Arbor. They have more experience with this treatment. And so I had to leave my previous neurologist. And now you're leaving, your former doctor who was a general neurologist, and you're going specifically to an MS clinic. So that's something for people out there in listener land. Just something to think about. Do you see a general neurologist, or do you see an MS specialist? And if you're a spouse or a caregiver for somebody with multiple sclerosis, do you have access to an MS specialist? And I think that's, specific. This is a pretty wicked disease. And I know for me to get my disease in into more remission, I had to take some pretty extreme measures. But now you're changing neurologist because your doctor retired. But you have talked, and we seldom mention medication by name because we're not advocating a treatment. But you have talked about your injectable medication and how you're running out of spots to shoot yourself. And I know that there are oral medications, and I am taking every 6-month infusion. And so when you go, potentially Dr. Braley will want you just to stay the course. But what if she does encourage or suggest taking another course of treatment? How will you handle that?
That's a great question.
Thank you. And Dan's canned answer typically when he says that, and I say, "Oh, babe, that's a great question." He'll say, "I was a reporter once." Well, I wasn't a reporter once, but I've had multiple sclerosis for a little. I'm trumping you with some seniority.
Yeah, and you can have that. I'm not going to fight you for that seniority.
That's fine.
But I think that, and I honestly, I would be a little leery if she wanted to switch my medications. And I think that's the part, when we, you out there in listener land or anybody, when you're changing neurologists and stuff, this first meeting on some levels, I mean, we're interviewing them. And we want to see, are they going to be a great fit for us? And I think that's the point that, everybody out there, you need to find that person that's going to be a good fit. I think that's because I loved Dr. Call, but I know there were people that did not like him at all and saw him once and left because, whether they didn't like his bedside manner. But that's what we as people living with multiple sclerosis can and should do. If you're not comfortable with it, you need to get out of there. I think, as I, work for a living in marketing different universities, and it's always talking about getting the right fit. And I think that's where I'm comfortable going to Dr. Braley. I'm excited. We often had talked, why don't we just go, all of us go to Dr. Braley. All two of us go to Dr. Braley because I'm going there anyway. But it will be different. I mean, how will I see her differently as a patient versus the spouse of one of her patients?
And then if you do see her differently, will you be able to say, "She's not my cup of tea, I can find another neurologist"?
Well, then would it be like breaking up with her, and then I'd have to see her every time that I'd go to see you, and it's just like seeing breaking up with an old girlfriend.
So this is a pretty big gamble. I hope that you will like her, and she's a professional, and I know deep down I'm sure she would understand. But, we have different courses of disease, we have different treatments, and we're different people. And people with multiple sclerosis, we always say that we're all individual, we're 1 in a million because we're all so different.
Are 1 in a million.
Yeah, literally we are 1 in a million. So I guess with neurologists, if this isn't a good fit for you, you have to be honest and say that. That's an interesting point.
Well, we say that just because, and these are things, for when any of us change neurologists and you go to a new doctor. I mean, if you, obviously because you chose to even pursue having them as your doctor, what kind of expectations do you have? And is it like, is like going to, I mean, I'm cheapening it. I get it, but I can't think of any other analogy. But it's like you see all the previews for the movie, and you go to the theater and you see it, and it's all hyped up. Are you ever afraid it's not going to live up to hype, or and that's
if it's not going to live up to the hype, or I guess the question that I asked you when, this was probably maybe 24, 48 hours ago, and I don't know if you've given it any thought, but what do you hope to gain going down to see her? I mean, certainly it's a yearly appointment, and I'm thrilled for you that you're back on a schedule, because how long has it been since you saw a neurologist yourself?
It's been a couple of years, I think, just by the time, because I think I saw Dr. Collin in June. He retired in November. Yeah, so it's been almost 2 years. I mean,
and that's a really long time. And thank God you had no disease progression at your MRI. But what do you hope to gain seeing a new neurologist?
And this is probably where I'd say I'm a bad MS patient? What am I bad if I say I hope to gain nothing? I hope to gain.
I imagine there are a lot of people out there nodding their heads because that's a really honest answer.
Well, and in saying that, I mean, I hope that it's a seamless transition. You know, because I know, and I've seen Dr. Braley at work with you, and I know she's going to take good care of me. But it's like I'm doing, I've gone 2 years without seeing a neurologist, and I've been fine. I had some, the hiccups with like getting prescription or getting, my disease modifying therapy prescription refilled, and having to do that through my primary care physician because I needed to have that script. But it's just like, I just hope it's seamless, and I don't, but at the same time, maybe that's where I need to grow up. Well, but I mean, it's just like, okay, so I say Dr. Call and I had him since I was diagnosed in 2000, but certainly, let me talk on myself in third person, but certainly
please.
The Dan Digman of 2019 is a lot different than the Dan Digman of 2000. And obviously my body, my brain, my nervous system and everything is not in the same shape. So thereby then, do I need Dr. Braley to be more aggressive and treat it differently because I'm not the same guy? And is that where had I become too complacent with Dr. Call, and I was just that good patient that would just go in? I mean, I was in and out of there in like 5 minutes, until, I mean, we were done in 5 minutes, and then I would ask him questions. But even at that, I would ask my questions, and we would sit around and you're just chatting like, we could have been at a bar,
And that's evidence of a really good relationship with a neurologist. But I wonder if she shakes things up, or if indeed you have become complacent, which I don't think you have, but will this light a fire under you how to treat it? I don't know. But I, as your spouse, I'm comforted by the fact that you have a neurologist now. So heaven forbid you have a flare-up, you have an exacerbation, you will be able to call your neurologist. And I think that will be really good. Does that comfort you to know that?
Absolutely. I think and if I needed a prescription or things like that, I think there, obviously, okay, for 2 years I didn't see a neurologist and everything, and I wasn't like freaked out the whole time, but there's times where you're just thinking, what ifs, and I have nobody who can help. But I guess so we talk a lot about then with me going in, but what's that going to be like for you, Jennifer? And this is something as we talk like as somebody with MS, but then also then the caregiver involved. What's that going to be like for you to go into that role, and you're just going to have to be a caregiver?
I'm going to have to be quiet, and that will be different because I'm chatty. But I think I want to be respectful of your privacy. And I don't want to say like, Dan, tell her this, or what about this, what about that, because that's annoying in my personal opinion. And
but don't I do that to you?
No, you've never done that, but you will shoot me the occasional glance. I mean, spouses, caregiver partners out there, when I'm glazing over something and you'll just shoot me that glance like, okay, Jen, be honest. So I hope that I do the same to you.
And I hope that you hold me in check, and that's where you're always good, because we go into these meetings that you have with your doctor, with Dr. Braley, of like, what questions are you going to ask her? What questions do you have? You tell me these questions.
And I encourage you, and I encourage anyone out there, if you're having an appointment with your neurologist, jot down your questions.
Yeah, whether it's a new neurologist or somebody that you've had for 20 years. You
will get in that appointment and you will forget what you wanted to ask or what's important. I mean, because if you see your doctor every 6 months, a lot of things can change, and over the time, just say, oh, hey, why is my foot dragging? Or I'm having trouble sleeping, I'm curious about oral medication, just write those things down so that you can ask and use that time valuably, use that valuable time efficiently.
Yeah, and I think that that's where, it'll be different too because, in terms of making it worth the effort. I mean, we're driving 2.5 hours down. I mean, our appointment is at 8:30 in the morning on a Monday, so we actually, like we always do with you, we get a hotel room and stay down there Sunday night, so we don't have to get up so early. And I wonder if, not that I ever took Dr. Call lightly, but I mean, it was just like a half hour over to Midland, and you're
This
always
is
there.
a
But I
big
think the
deal.
fact that you invest money for a hotel and a drive and
And
taking
your
a day off
time.
work to go down to the neurologist, do we take it more seriously? Does it become an investment? It's going to be.
I hope, this appointment will be, I hope, really good, and I look forward to talking about it again, and just, I think that this is going to be really good for you, and that's the most important thing, is your health and managing your multiple sclerosis.
And so with that, I mean, we've talked. I mean, I'm seeing a new neurologist because my neurologist retired. But again, I mean, for all of us out there in Listerland, you're living with multiple sclerosis. You have a neurologist. Just make sure that it's somebody that you're comfortable with, that gives you the care that you need and want,
And answers the questions that you have in a thoughtful way that you understand, and that's someone that you feel comfortable with, like Dan said.
So we'll be excited to report back. So how do you deal with it when you see a new neurologist, and what questions do you have, and how do you prepare for that? Let us know. Check us out on our website, danandjenniferdigman.com, or look us up on Twitter, danjendig, and just let us know and stay in touch with us. We appreciate you having us here, and thanks for taking the time to listen. This has been a couple takes on MS with Dan and Jennifer Digman. Thank you to Blue Giraffe Kid for composing the theme music for our show, and thanks to the MS&Me Radio Network for having us on. Take care.